putting an enormous strain on the NHS. Today's figures expose just how acute that strain is and how the NHS is buckling under the burden. Brenda Mountford, who has dementia, has been one of its victims. She was forced to wait for hours on a trolley in a corridor at an A&E department in Oxfordshire. But her daughter-in-law Amanda said not before she spent 2 hours in an ambulance waiting to get into A&E.
It was very cold in the ambulance. It was a cold, frosty night. She was complaining she was cold. They had to keep starting the ambulance up for the heaters.
And her experience is far from isolated. Last week, 4 in 10 hospital trusts in England issued major alerts as bed shortages worsened and A&E departments became overwhelmed. 6 of them declared the highest alert, level 4, meaning patient safety was at risk. 2 of them in Bristol, 3 in Merseyside, 1 in Lancashire and 2 in the Midlands. Revealing the sheer scale of the problem, meaning this winter has seen A&E departments at their busiest for 15 years, with many doctors saying they haven't experienced anything so bad.
3 or 4 things are causing it. First of all, we're becoming an older population. Secondly, we know that in some areas there are problems with social care. We also know that in some areas it's difficult for people to get a GP appointment. So what happens is people who quite rightly want to be seen by a medical professional, they see the lights on in the A&E department on 24 hours a day, 7 days a week, so they go to the A&E department.
What these figures show, and show starkly, is that the NHS in England is not only in crisis, but it's reaching breaking point. And although that strain is being felt acutely at A&E departments like this one, that huge pressure is also being brought to bear across the health service. With extremely tight budgets and unprecedented demand, many now say the pressure on the NHS is unsustainable. Sejal